So welcome to this second webinar on early childhood development. For all those who are new to it, I'm your host, Karin Weiss, project leader at Medicus Mundi Switzerland. Medicus Mundi Switzerland is a network of over 50 NGOs working in international health cooperation. This webinar series was developed based on the interest of our member organizations to dig deeper into this topic and integrating this concept more and more into their projects and program. In this first webinar, we learned about what is nurturing care by two wonderful experts, Bernadette Delmans and Sheila Manji from WHO. We learned about the importance to invest in early childhood development right from pregnancy and beyond. We now understand that the period from pregnancy to age 3 is the most critical, and the brain grows faster than at any other time. 80% of baby's brain is formed by this age. We also learned that investing in early childhood development is cost effective. For every dollar spent on early childhood development interventions, the return on investment can be as high as $13. Current estimates are that nearly 250 million children aged under 5 years in low and middle income countries risk missing critical development milestones due to poverty or stunting. Today, we dig deeper into this topic, and we will hear from Detjen, a child health specialist from UNICEF, about how to strengthen nurturing care in routine health and nutrition services. We then hear from Rafael Perez and Hromi-Fiedler from both are from Yale School of Public Health, about how to strengthen nurturing component of UNICEF's infant and young child feeding counselling package, with examples from the field. Now switch off your mobile phones and turn off your email accounts so that you can be fully present in this webinar. Please feel free to use the chat box to comment or ask your questions. We will address them as soon as possible. So welcome, Anne, and good morning. I'm really impressed by our speakers who got up really early, but the three of them are living in the US. And thank you so much for taking part. The floor is yours.
Thank you, Karina, and good morning, guten Tag, everyone. I would like to talk this morning about the role that health and nutrition services and their providers play in supporting parents in their understanding of and their skills to provide nurturing care to their children. You are among the first to get a little sneak preview into a practice guide that we are currently finalizing that outlines some guidance on how to strengthen these services. So Bernadette Delmans, as Karina said, from WHO last week, introduced to you the 5 components of nurturing care: good health, adequate nutrition, responsive caregiving, early learning, and safety and security. All of these are interrelated and all of them are required for a child's healthy growth and development. The Nurturing Care Framework, which Bernadette also introduced, proposes 5 strategic actions to adopt and operationalize nurturing care in a country context: leadership and investments, a commitment to and focus on families and communities, strengthening of existing services, monitoring of progress, and the use of data and innovation. Today, I'd like to focus on strengthened services. So health and nutrition services play an important role in strengthening nurturing care. Parents and caregivers are really the ones who are primarily responsible for the care of their children, and all of them do require some kind of support and encouragement. Other caregivers might have limited capacity or feel insecure and might need some more intense support. So that might be first-time parents or adolescent parents, but also those that are exposed to stress or conflict in the household or the environment, or those of children with special needs. Pregnant women and caregivers of young children, they have many scheduled and unscheduled visits and routine interactions with health and nutrition services throughout the early life course, so that time period that's really important for nurturing care. And these services already include some interventions that are essential for nurturing care, such as support and guidance to providing good health and nutrition. The access and the quality and utilization of these existing services is often not optimal in many of the contexts where we're working. Interventions that focus on support to caregivers are often not prioritized. For example, in the context of sick child visits, the provider might focus on the prescription of tablets to a sick child, let's say pneumonia, but not necessarily on guidance on how to ensure the sick child continues to feed well and still during illness has opportunities to play. And while these services focus on health and nutrition, support for the other three essential components of nurturing care is often missing. Also missing is support to caregivers, whose mental and physical well-being are really essential for them to be able to provide nurturing care to their children. So the practice guide and the rest of my presentation will focus on ways to add support for these four elements: responsive caregiving, early learning, safety and security, and support to caregiver well-being. The practice guide targets those providers of health and nutrition services and the managers that have to organize those services and ensure their providers have the right skills and resources to support caregivers. It focuses on universal support and services that should be accessible to all children, while emphasizing the need for more targeted or indicated support to family or caregivers with special needs. It introduces considerations to serve all children and their caregivers, including those with chronic illnesses or those living in humanitarian settings. So the practice guide has three parts. One explains the rationale for strengthening support for responsive caregiving, early learning, safety, security, and caregiver well-being. Then it talks about the role that managers can play to reduce barriers, build the skills of providers, identify resources for additional support. And last, it gives some very practical examples how providers during existing touch points where caregivers access services, what they can do there in those services to support caregiving skills. So the aim is to really enable health and nutrition services to create an environment where providers can use opportunities during their many routine interactions with caregivers. They can observe, they can ask questions, they can make suggestions and model behavior that helps to build and strengthen some caregiver practices. And they can be sensitive to respond and identify caregiver needs. So here are just some of the examples of caregiver practices that would support nurturing care. So for responsive caregiving, it is the importance of spending time with the child, recognizing and responding to the child's signals and needs. For early learning, it is the engagement with the child to talk, sing, play, even while performing tasks, and following the child's lead, assisting it in exploring the world. For safety and security, it's the understanding and building of trust between the caregiver and the child, the protection from harm, injuries, and to establish routines and apply positive parenting methods. And last, it's really if caregivers are not able to provide nurturing care if they are not well themselves. So providers can create a space where they can ask questions about caregivers' mental health, about coping with the changes that a child brings into a family, and identify those caregivers that need referral for additional support. All of this support to parents requires a set of specific skills by providers, skills that are often not prioritized in pre or in-service trainings. There are skills for interpersonal communication, and then skills that are specifically aimed at supporting caregiver practices. Some of these interpersonal skills, they are included in existing packages for integrated child health services, and a few of them are named here. So essential newborn care or integrated management of child health services, but they can really be re-emphasized and strengthened. Then there are specific standalone training packages that support caregiver practices. One example is the care for child development or caring for the caregiver. And ideally, providers receive training on these packages themselves, adapted to their cultural context. But the practice guide uses a lot of examples from these that help providers of services to get started right away. It's the role of managers to ensure that providers can acquire and practice these skills. But managers also need to strengthen the organizations of the services themselves to support caregiving. So this can be by, for example, ensuring that case management protocols meet the needs of families and children. One example are child services, who are really ideal to incorporate time and focus on caregiving. These services are often scheduled, and focus on preventive and promotive care. And but in order to sort of allow providers the additional time needed for observation and discussion with caregivers, ensuring they have some equipment, for example, toys available that needs to be considered in the organization of services and scheduling or timing of these visits. Acute and chronic care services have a little bit of a different purpose, but they also should incorporate elements that strengthen responsiveness and the continuation of opportunities for play and learning. But these interactions in the context of sick childcare really need to focus on the acute needs of the child, how to be responsive to and nurture a sick child. Then there are home visits, which are an ideal environment for providers to meet the caregiver and the child in their own environment, to check for safety, to observe interactions and play in the house. Managers have a role to make sure that supervisory visits pay attention to not only the services themselves provided, but the quality of provider interactions with caregivers and their children. So whether they can apply those interpersonal skills that I talked about earlier. And then facility surveys, for example, could include aspects of whether a facility is accessible, child-friendly, etc. Managers also play a role in establishing policies that support family-centered care and enable caregiver participation. So one example would be, for example, a newborn care intensive care unit, which can be a real intimidating environment for caregivers. But imagine if instead an environment is created where caregivers can learn and participate in the care of their newborns, where they can continue to breastfeed and provide kangaroo care. They then have a chance to bond with their children and are much better prepared to care for them after discharge. Waiting areas is an opportunity to create space for caregiver education, either through information that's available, video screenings, or also small parent groups that can be held in those areas. And then last, but really important, managers have a role to ensure a role to play to ensure that they map the availability of and established mechanisms to refer caregivers to special services that they cannot provide in the context of routine, basic primary care services. And if these don't exist, then managers have an important role to play to help advocate for their establishment. So another thing is we all know the difference that it makes whether a facility is welcoming, clean, and child-friendly or not. And managers can really ensure that their facility is accessible, including for children or people with disabilities. They can create child-friendly spaces and amenities. For example, here in the right bottom corner, you see a play box that can be positioned in good, ideal places in the facility, where they can create play corners that can be staffed by volunteers that support caregivers and children in play. They can provide information material and hold sessions on caregiving and nurturing care. Nurturing care becomes even more important in humanitarian settings, or as we all still experience in the pandemic context. And these conditions, they challenge health services in many ways and often reduce access, but also the scope of these services. And while the psychosocial needs of children and their families increase, they are rarely prioritized in the humanitarian response. So it's important to advocate for and ensuring that nurturing care and caregiver well-being are integrated in the assessment and the planning and the implementation of any emergency response. I'm not going to elaborate more here, but provided some examples of guidance and materials for nurturing care in the humanitarian and pandemic contexts that you can find, for example, on the Nurturing Care website, nurturingcare.org. Now I'm coming to the last part, and this is really triggered what triggered us to develop this practice guide. It's the question that we kept getting from our country colleagues, from providers and managers of what exactly do you mean when you say that providers should support nurturing care and build caregiver skills. And that's often people who are not familiar with some of these training packages that I mentioned earlier on caring for child development, etc. So the last part of the practice guide provides some illustrative examples for strengthening each of these 4 elements in the context of existing services along the life course. So it considers the specific needs of children and caregivers during these moments or touch points, as you could say. And the services that are included are antenatal care and postnatal care, well child care, but also acute and sick childcare and nutritional rehabilitation services. The examples for things that providers can do to support caregiver skills are illustrative. They don't have to be addressed at the same time or at each interaction, but they can be incorporated at opportune moments. The examples do not replace these existing trainings that further strengthen provider skills, but they can help them to get started and have a better understanding of what this could look like. So I'm going to show you only one example of how this could look like in the context of well-child services, which, as I said, are very opportune moments to devote time and support to caregiver practices. So providers might want to support responsive caregiving and ask the caregiver questions about whether they find time to spend with the child. They can observe how the caregiver and the child interact during the visit, but they can also demonstrate some responsiveness. So for example, when they examine the child, they can touch it, they can talk to it, they can look at it. They can focus on early learning by talking about the toys that caregivers might find in the home and how to make time to play with the child. For safety and security, where skills are really about building trust and a safe home environment and the importance of routines, providers can discuss the impact of the caregiver's emotions on the child's emotions and reactions. She can discuss how to create a safe environment at home and to make sure that the child is not alone or at risk when the caregiver cannot be there. To ensure the caregiver's well-being, the provider can ask whether the caregiver is coping well, faces difficulties in taking care of the child. The provider can look at the mood and the emotions of the caregiver during the visit and find out if there's help in the home. And if needed, the provider can refer the caregiver for additional support. So that's just one service example, and the other entry points are structured in very similar ways. And before I end, I just wanted to highlight one additional aspect, that improving the skills of providers of health and nutrition services for nurturing care will allow for this really important support to caregivers through these services. But I think it's really important to also convey that it will hugely benefit the quality and the experience of these services themselves, and therefore the health and nutrition outcomes of children. So a mother who engages with a responsive provider feels much more supported and listened to, and she will adhere much better to the treatment or other advice that's given compared to a mother who hasn't been addressed properly, who hasn't been looked at, who hasn't been able to ask questions and hasn't felt cared for. So with this, I hope I was able to give you a little glimpse into the opportunities to strengthen services for nurturing care. Watch out for the practice guide, which we hope to release in May or early June, and it will be available on the Nurturing Care website together with other resources and learnings from countries. Thank you very much.
Thank you. Thank you so much for this very inspiring talk. I just made a note to the practice guide that it will come out May or June, and we can use this list also to make some advertisement and send it out so that no one is missing it. If there are any questions, please feel free to use the chat box. We are more than happy to address your questions. And now I think I would like to hand over, if there are no questions, I would like to hand over to Rafael and Amber for the next speech, and then we go into a Q&A. Thank you so much. The floor is yours.
Thank you so very much, Karina, for your kind invitation, and what an honor to follow Anne's outstanding presentation, which Amber and I think is going to connect very well with our task, which is to provide you a little bit more specifics on how can we strengthen nurturing care through health and nutrition services. As it was covered extensively by Bernadette and Sheila during last webinar and reinforced by Anne today, we can think of the nurturing care as a flower that has 5 petals that includes the domains or sectors that you are seeing on your screen. You can notice that each of these petals is of equal size and that the framework is a circle. And what this means is that children, since they are being gestated, they need to be surrounded by each of these petals all the time and in all the environments in which they live. So it is very important to acknowledge that for nurturing care to work out, it needs stable environments where children receive love and stimulation responsive to their developmental stages. And during Amber and I's presentation today, we're going to emphasize how can these be supported through the health and nutrition sectors or platforms in the countries. We know now very clearly that nurturing care during the first days, since conception, and the first days and weeks and months and years of life is actually crucial, not only for the physical growth of the human being, but also it is very crucial for infants and children to learn healthy dietary habits and to benefit from a very helpful transition from being fed mainly through the umbilical cord during gestation, then subsequently through breastfeeding, and then the introduction of complementary foods to rapidly transition into the family meals, that there should be no reason why it shouldn't be the same pretty much by 2 years of age as the meals, the way they are being consumed by the whole family. So we oftentimes forget that the first, say, 1,000 days of life and beyond are really, really crucial for the children to be able to develop healthy food preferences that very likely can remain for the rest of their lives. We now know that among many other authoritative bodies, UNICEF has strongly recommended to really strengthen the nurturing care component or foundation of the nutrition domain within the nurturing care framework. So we know now that responsive feeding really involves the application of all the components of nurturing care to the feeding process, and that this gets into the heart of the how to feed the babies, which is as important as the what to feed the babies. So at the end of the day, responsive feeding is a very important approach to strengthening the nurturing care content or component of services offered through the health and nutrition sector at the different touch points during gestation, infancy, and early childhood, already mentioned by Anne. So responsive feeding has been shown to have very promising positive impacts in the nutritional status, in the feeding practices of babies all over the world, in low, middle, as well as high income countries. We also know, based on the Lancet series that several of us played a role in 2016 related to early childhood development, that there is no doubt that it requires the nurturing care for the families to be able to deliver it properly to the child, and for the child to receive it in all the environments where he or she is growing, including the early child health and education centers. It is crucial that these families, no matter their social class, the socioeconomic status, the neighborhoods where they live, and so on, have access to all the health, nutrition, education, social and child protection services that are needed for offering the proper nurturing care for the babies. And we now know also that this access to services, especially in low-income neighborhoods or rural areas and so on, will not happen unless they are very equitable and effective national economic, healthcare, education, social protection policies, food and nutrition security policies, and so on. Having said that, it is also key for really the health and nutrition sector to have first-class, world-class materials that can be used in both community and healthcare settings to actually counsel properly families on how they can do in their context to enhance and deliver nurturing care through the feeding process of their infants and young children. So one of the key tools that was developed about a decade ago by UNICEF and many other partners is the community infant and young child feeding counseling package, that it is totally evidence-based and it is very well manualized in terms of the key counseling messages, in terms of the training of community health workers, and also can be used for the training of healthcare providers in primary healthcare units on how to actually facilitate and convey the counseling information appropriately, and includes loads of cards and very attractive materials that participants can learn from based on a very participatory pedagogical approach. These cards are can be very impactful, these counseling packages, because they are already being used in over 80 countries, many of them located in sub-Saharan Africa, South Asia, and Southeast Asia, but also in other parts of the world. And these cards are also very attractive because they have been packaged in a way that they can be adapted to the local context and be replicated, disseminated fairly rapidly once a government makes a decision to adopt them and receives the right support on how to move forward with the implementation of this counseling package at both the community as well as a health facility level. So in our two-part talk today, I will cover first a nice review that Amber recently led in full partnership with UNICEF on assessing the gaps on nurturing care content in this UNICEF CIYCF counseling package materials. And the idea was not just to do this work to criticize, but it was really to identify gaps so that very specific actions can be taken. And Amber will share with you which specific actions she's now leading together with the University of Ghana, UNICEF, Ghana, and the Yale School of Public Health to try to translate this knowledge into practice. So the specific goals of that review were to identify and map existing nurturing care elements using very state-of-the-art systematic qualitative research analysis techniques. And we were able not only to identify these gaps within the generic package, but also to identify positive examples of country-level adaptations that have already, in the minority of countries, we must say, have been able to integrate nurturing care effectively, so that we can talk in a more concrete way and not just in the abstract. And then to develop recommendations on revisions that UNICEF could call for to the generic package to incorporate additional nurturing care elements. It was a very, very exhaustive process that it really involved developing a pretty massive code book to try to identify the presence of absence of content related to all 5 domains of the nurturing care framework. And at the end of the day, through this process, we were able to identify countries that were following best practices And we also conducted in-depth interviews with key informants in the UNICEF offices in those countries to try to understand better why they were successful at incorporating nurturing care as part of their IYCF packages. So the first very important gap that was identified is that in very few of the countries, they had included nurturing care content linked specifically to nutrition. So within the generic package, there was a lack of framing of healthy child growth and development in the context of nurturing care. There is a need to link responsive care and feeding to child development. And there was a lack, the link between nutrition and psycho-emotional, social, and cognitive development. And the good news, as you can see in these beautiful cards, is that the countries like Kenya, for example, have actually been able to link really nutrition to child development, and to really illustrate very nicely that responsive feeding or responsive feeding practices are very much needed as part of the nurturing care content of these cards. And they also do the same with some health topics like immunizations, linking them also to child development and an understanding of the feeding process of the baby, so that the moms and families can actually link the developmental stages of the child, not only to the needs for immunizations, but also to what should be happening in terms of healthy and nutritious feeding practices. We also identify that responsive feeding was not really included in the context of responsive parenting, such as the message of feeding with love, sending the message that parents, partners, everybody, not only the mother, but everybody should really engage in the aspects of nurturing care for infants and young children, including very loving interactions, reading, playing, and of course, the responsive feeding process. So there is a need to include more content related to the link between sleep, soothing techniques with the feeding process, responsive feeding, and how, for example, linking the food texture needed to the developmental stage of the child, how to figure out the behavioral developmental cues that the babies must show before complementary foods are added, are also a way to show how important nutrition is for the rest of the nurturing care components. There was a lack of content related to the family life course approach that is very much recommended as part of the nurturing care framework. But again, Rwanda provided very nice examples of best practice counseling content to really illustrate how important it is, really the nutrition, food security, the feeding process, and on across the life course, following pretty much a whole family approach to it. And also in the Philippines, they have a nice way to link responsive feeding, nurturing care as applied to the domain of nutrition early on in life, to very positive long-term outcomes, including higher levels of attained education and a more successful professional life in adolescence, young adulthood, and later on. The third gap was that child protection was hardly addressed in any of the packages in the countries. And there was an exception, which is Pakistan, which actually had very clear messages about how unacceptable it is to practice harsh discipline, and really how important it is at the end of the day to really discipline with love, and to have a family approach where both not only the mom, but also the partner or the father of the child gets very engaged with these very patient and loving interactions that should be part of the approach that caregivers need to follow to understand what the infants and young children are trying to communicate through their cues across their developmental stages. There were no examples of social protection, such as the importance of conditional cash transfer programs and so on, linked to responsive feeding. Also, we found that the recommendations for HIV, especially for the mixed feeding ones, were outdated and that they really needed to be updated in the context of the availability of antiretrovirals now in the parts of the world where they have been the most affected by the HIV pandemic and the maternal to child transmission of the HIV virus, and how important it is to take into account the feeding of babies in special circumstances, such as when the mom is HIV positive, totally following a responsive feeding / nurturing care approach. Regarding gap number 7, and this was addressed, this need by Anne, there was a lack of information in the generic packages on how to feed and meet the needs while providing nurturing environments. Countries have not integrated this into their packages either, although the Philippines has cards related to disabilities, including how to recognize some of them, but they have not taken it as far as do it in relationship to the nurturing care feeding process. So the lessons learned is that we recommended integrating, splashing nurturing care content throughout the cards into existing cards, and just to add new cards whenever it was absolutely necessary, because there are already lots of counseling cards in the package, and that there was the need to develop a standard process for actually developing nurturing care materials. So we will see how these recommendations are being applied by different organizations, and some of them are being led actually by Hromi-Fiedler, which she will share in a moment. And a third point here that was also brought up by Jan is the importance of also examining and understanding how to integrate the nurturing content of these packages, of this package, the infant and young child counseling, infant and young child feeding package, into other packages such as care for child development, integrated management of childhood illnesses, and so on, so that they look alike and they send similar evidence-based messages across the basic healthcare packages, and there is harmonization with these materials. We also identified the lack of specific packages for Latin America and the Caribbean, which also needs to be addressed, and also strongly recommended based on the key informant interviews, the use of information technology for training and dissemination. So I am very pleased to report that there are very specific actions that are being taken as we speak to address the sorts of gaps and recommendations that were made through the UNICEF global review of the counseling package. So first of all, multi-advancing nutrition, the flagship USAID multi-sectoral maternal, infant, and young child feeding initiative has developed a wonderful responsive care and early learning addendum for IYCF counseling, and has made available to the world really this wonderful image bank that is being used to actually adapt, modify, or introduce new cards with very strong nurturing care content. Also, UNICEF, in strong partnership with the Advancing Nutrition USAID team, developed these counseling cards during COVID-19, which illustrates very nicely different components of nurturing care. We know breastfeeding is the mother of nurturing care, and the tragedy that happened when all these babies were being separated from their moms because their moms tested positive at birth, and when there was actually no need to do anything like that. And then it will now transition into Amber's section of the presentation, where she will talk to us how she herself has led a wonderful team to respond to these recommendations through very innovative approaches in Ghana. Amber, over to you.
Thank you so much, and I'm delighted to be here. So I will be sharing with you this example about how our team really applied nurturing care principles to nutrition counseling in Ghana. And specifically, we'll be really addressing one of the gaps that we've found, which is integrating responsive feeding in the context of responsive parenting, and how we can integrate that into the infant and young child feeding counseling package, the UNICEF counseling package. And Ghana does use the UNICEF generic community-based infant and young child feeding counseling package to train their providers and to provide education to mothers on infant and young child feeding. So therefore, we developed these two projects to first develop and test the appropriateness of evidence-based responsive feeding counseling cards, and then to test the feasibility and acceptability of integrating responsive feeding into existing infant and young child feeding counseling in Ghana. And these projects relied very heavily on the feedback and input from target populations to help tailor the design of the responsive feeding cards, as well as the program that integrated responsive feeding into IYCF counseling. And project one was a qualitative study that incorporated focus groups, in-depth interviews, and educational sessions to assess the appropriateness and feasibility of the responsive feeding cards and messages. And I'll share the results with you. Our focus groups were conducted with mothers and fathers of children that were younger than 3 years old and who were involved really in feeding the children. And these focus groups were intended to understand the knowledge, attitudes, and practices around infant and young child feeding and responsive feeding itself. What we found was that healthcare providers at antenatal, postnatal level, as well as those that were involved a little bit later in growth monitoring and vaccination, all across the spectrum, were directly delivering education on infant and young child feeding. And that in turn influenced responsive feeding and responsive parenting knowledge and practices among these parents. As well, what we found that parental knowledge about food safety and food allergies influenced infant and young child feeding practices, and also subsequently provided responsive feeding by allowing the parents to really provide more attention to the needs of the children. And then finally, the family and friends in the community gave the parents informational and instrumental support. So in the previous slide, just including educational counseling on childcare practices, and they helped with doing chores for parents and giving the parents time off to respond to their children's needs. And so the support from the family, friends, and the community enabled the parents to learn and adopt some of the responsive feeding practices and behaviors. What we did find as well was that there were non-responsive feeding practices, such as hitting crying children. And that demonstrated to us that there was really the need for more high quality responsive feeding, responsive parenting education. Next, through focus groups and educational sessions, we learned that the developed responsive feeding cards and messages were culturally appropriate and reflected new material that mothers and fathers and other caregivers wanted to learn and felt that they actually could practice. Each of the 5 cards reflected responsive feeding parenting concepts in the images and the messages. This card itself demonstrates the importance of role modeling, positivity, including children in mealtime, actively engaging fathers in mealtime, and really making these meals more enjoyable in fostering a nurturing care environment around mealtime. This card counsels caregivers on recognizing the signs of hungers in society based on developmental stages. Infants and young children will respond in age-appropriate ways to tell that they are hungry and full. And so this card really is intended to help parents or caregivers recognize these signs early, and plus also to engage with their children in a positive and emotionally supportive manner when feeding them. This card counsels caregivers on why texture needs to be changed rapidly during those first 2 years, according to their developmental stages. The fourth card counsels caregivers on how to introduce foods in a gentle and kind way without forcing a child to eat. In addition, this card teaches how to encourage eating through nurturing ways such as singing or playing. And then the last card, caregivers are counseled on how to calm a child without using sweets to soothe, or yelling or hitting or ignoring a crying child. This teaches that it's important to choose the right soothing techniques based on what the child needs. We also conducted interviews with healthcare providers to understand their perspective about the responsive feeding counseling cards and their applicability and feasibility for caregivers. The counselors, or the healthcare providers, did share with us that they do share many of the responsive feeding messages that we did show to them in the cards. However, they are primarily, these responsive feeding messages are primarily during one-on-one counseling rather than in group sessions. And what this means is that everyone is not getting the responsive feeding messages, nor are they receiving messages in a very consistent way. And when we asked providers what they thought of the messages and whether they felt that they would be applicable, important, and understandable, as well as easy for caregivers and infants to practice, they overwhelmingly felt that the messages were applicable and important. And lastly, providers really liked the cards and felt that they should be integrated into the counseling as noted by the participants. And in the previous card, what it says that from the providers, we learned that to implement a responsive feeding curriculum, we needed to integrate it into the existing UNICEF IYCF counseling package. And providers felt that a formal 1 to 3 day training course in infant and young child feeding was needed in addition to responsive feeding curriculum. And providers felt it was necessary to provide transportation, adequate materials for parents, for providers and caregivers, and that the training needed to be interactive. And so in summary, this project demonstrated that responsive feeding messages and cards are feasible for caregivers to practice, and some responsive feeding messages are being transferred to caregivers, but not all messages are being transferred and not in a consistent way. The responsive feeding curriculum that includes cards and messages is really desired among healthcare providers to provide a standard education, but that to integrate responsive feeding into existing infant and young child feeding requires training. So we use these findings to inform our next project, which sought to integrate responsive feeding into infant and young child feeding counseling to strengthen the infant and young child feeding programming in Ghana. This project had several phases that were designed to document barriers and facilitators to optimal infant feeding practices, really focused on exclusive breastfeeding, meal frequency, and diet diversity. And this project also sought to strengthen infant and young child feeding counseling directly through the integration of responsive feeding counseling. And we did this through a Trials of Improved Practices methodology. What we have learned is that There are barriers and facilitators across the socio-ecological model to exclusive breastfeeding practices and complementary feeding practices that are both common and unique. This is a fairly extensive list of barriers and facilitators, and this one focuses on exclusive breastfeeding practices. And what I wanted to highlight are some of those that are unique to exclusive breastfeeding practices. This includes the structural barriers, which is right here at the top, of not having breastfeeding workplace policies, which is a very important barrier to exclusive breastfeeding. Interpersonal barriers of lack of exclusive breastfeeding education that's provided by counselors is a key barrier. And then when we look at the individual level, we see barriers that include perceived breast milk insufficiency and breast problems that can really be pose difficulty to exclusive breastfeeding. Some of the unique barriers to complementary feeding were primarily related to access and availability of food, food safety, and the lack of money. The latter, the lack of money, was really touched upon at the community, interpersonal, and individual level. So it really extended across all of those three levels. So to address barriers and help caregivers achieve infant feeding recommendations, our qualitative findings supported strengthening caregiver and providing education and training. For caregivers, we found that intensifying IYCF counseling and education across many maternal child health topics, plus providing more outreach to caregivers in the form of home visits, was cited as key ways to achieve infant and young child feeding recommendations among caregivers. For providers, our findings were consistent with the previous project in that it was really very important to provide more and intense infant and young child feeding training, as well as to really make sure that they had those counseling cards and the tools to use during their counseling and educational visits to be able to really help caregivers. The findings from this qualitative phase informed the development of a trials of improved practices, which we call the TIPS, which we developed as a home visiting education that was focused on improving infant and young child feeding practices through the integration of responsive feeding, and it incorporated very key concepts of shared decision-making and motivational interviewing. We just finished this trial, but our preliminary data is showing, our qualitative preliminary data is showing that mothers really did appreciate the home visits, and they felt that they did help them improve infant and young child feeding practices. Some mothers felt it helped them unlearn poorer infant and young child feeding practices, while for others, it changed their knowledge. So for example, some mothers who started complementary feeding didn't realize that they could incorporate local foods into the diet of their children. And through this trial, they did learn how and why to begin feeding local foods. Mothers also felt that they were included in the shared decision-making process, and they actually felt privileged that the nurses came, visited, and helped them. The use of counseling cards, both the responsive feeding and the IYCF counseling cards, were important for delivering messages and helping mothers understand the recommendations that were being made. Both mothers and the community health nurses that visited them wanted more visits to help change behavior. Some mothers with young children who were only breastfeeding at the time of the visits really wanted those continual home visits, not only to help them change their behavior for exclusive breastfeeding when problems arose, but also to help them transition into complementary feeding. We did encounter some barriers, and those barriers, one of the barriers was that mothers were not always there when the home visits were conducted, and that made more work for the community health nurses. In our project, some mothers really lived in very rural areas, and it made it very difficult to travel. So continual home visits was a bit difficult for the community health nurses. We also conducted this project during COVID, and the nurses were very tasked with COVID-19 vaccination campaigns, and that limited their availability for home visits. And so the findings, so in summary, what we've learned from these projects is that co-designing programs is really critical to their acceptance and sustainability. Integrating responsive feeding into an existing IYCF system can be accomplished. It's accepted. However, it is important to keep in mind that providers are engaged in many tasks, and they need to be monitored so that to prevent being overburdened. It is also essential that providers are given formal training in IYCF and in responsive feeding, as well as that they have the appropriate tools. Too often we see providers sharing one set of counseling cards among several, and it reduces the availability for them to provide effective, consistent counseling. Thank you so much.
Thanks to you for this very comprehensive presentation. Looking at the time, I think we will take a few more questions from the audience before we do a closer of it. So thank you so much for all this in-depth information. I'm wondering how our member organizations, we are from the civil society, how can they pick up this information and how can they implement it in their projects?
I can start. Maybe I think you know, there are many good examples, as you just heard from Amber and Rafael, and the nurturing care framework itself and the related documents sort of lay out, you know, ways on how to really support the uptake of nurturing care within services, not only health and nutrition, but it's a real multi-sectoral response that's required. And I think any organization can help by bringing this conversation and this topic to the table in your engagement in countries, be it at the national, the policy level, or be it at the implementation level or in projects that you are supporting, finding ways of how to review first of whether things are done or not that would provide nurturing care, or what opportunities there are to strengthen. Another thing that we're always eager is to really learn from experiences. So, you know, sharing with the broader community the lessons learned coming from projects where you might be addressing nurturing care would be really helpful. That's something that countries usually appreciate very much. So I think just engaging and finding entry points in the national context is a great support by anyone.
And I briefly just want to add that the civil society organizations or NGOs, local NGOs, must be taken into account and engaged as, for example, helping develop the trainings, keep oversight of quality control of materials and you know, training protocols, training of trainers cascades. But at the end of the day, you know, it should be owned by the governments. The government should scale this up, include permanent budgets for this type of work, and not pass on the full responsibility to NGOs. But definitely NGOs are extremely important in the you know, that they leave the training, the quality control of any kind of implementation related to the nurturing care framework. They're really,
that was
really
the discussion. That was the discussion we had last time, that it's usually the NGOs who do the advocacy work in order to sensitize the government for taking up early childhood development. Yeah.
I think that in many places there's also really a cultural change that's needed, right? These are often behaviors and practices that are not necessarily as widely adopted or accepted or understood. And I think that's a role where civil societies that are really rooted often in communities can help to foster that change, but also encourage government to provide the space for that and the support for that.
And I wonder, Amber, if you can share the role of Point Hope in your projects.
Sure, we work with a local organization in Ghana who is a very strong service-based organization, and they have taken on the role with us of providing training to healthcare providers, of really integrating themselves into some of the practices that are in Ghana, and so they have been established there for quite a number of years and are well respected within the central region in Ghana.
So for gaining the trust of the community, can you imagine in the middle of COVID, Amber was able to keep this project going with our partners in Ghana, and the civil society organization was the key, I would say.
Mm-hmm. They are very well trusted there, and that is primary key.
There's one more question which we will take up. Thanks so much for all the talks. How can we support parents to apply these approaches in an environment which distracts caregivers to do so? General workload, cultural roles, and so on and so forth.
Well, I'll just want to point you back to that whole of society approach image that I showed, that I'm sure Anne and colleagues have also used a lot. It's very difficult for any family, for any caregivers to do this alone. There needs to be access to food security, to health security, to social protection, to initial education, early stimulation opportunities, safe communities, and so on. And that's where policy has to play also a very big role. And it's very difficult for anyone. And then can you imagine for families that are very poor, that are being affected by civil conflict, by natural disasters, that have kids with special needs, and on and on. So this really, at the end of the day, we have to be realistic. It requires a whole of society commitment and empowering the countries to be able to own it and not to rely just on foreign technical assistance to be able to do this work. It's okay to get started, but I really think that's what it takes. And it's the same question from the early childcare and education staff. Oh my God, this is a lot. This is not going to work if the parents don't do the same at home. Yes, they are right. So everybody really needs to be networked, and the harmonization that Amber has called for globally in messaging across packages is crucial. Because if they're hearing different things from different providers, from different sectors, this is also not going to work.
Yeah, maybe just to add, I think it's really important to create these spaces where everybody can come around the table and agree on what is important and what should be prioritized. As Rafael said, this is something that requires engagement and change at every level. I refer to sort of the cultural change that's needed. So how can you really engage communities? And there are ways to do that through media. We're talking a lot about the role of, for example, churches and faith-based organizations that have a lot of influence in communities. How can you engage those in facilitating that change? And then I think it's also really practically during home visits, during engagements with providers to address the whole family, and not only, reach out to what's the the first thing, the mother, who's mostly the primary caregiver, but bring parents into that, fathers into that conversation, or other families, make them understand that the mother cannot cope with everything on her own, that this is something that everybody contributes to, and that, it's an environment that needs to be created in a family, a household, a community. So I think there's a lot of work to be done around that for sure.
Thank you so much. It was a rich webinar today again. So a lot of information which we received from all of you, and thank you so much. I will compile all the information and we'll send it out to all the participants in the mailing list. And I would like to wish everyone a wonderful day, and for you a wonderful start into the day, because it's still very early on your side. And I really thank you so much for taking part in this webinar series. All the best, take care, and next week we will again on Tuesday, same time, 11 o'clock, we will have the third and last webinar, which is on how can NGOs work with governments and health systems to ensure all children receive nurturing care. We will have Maria Marelli, early childhood development specialist, and Maram Shahin, also a specialist on this topic from Syria, on the webinar. So I look very much forward to it, and again, make advertisements, send it around so that more people can have advantage of this wonderful information. All the best, have a wonderful day.